Now let's discuss the auricular acupoints for AcuLift. Auricular acupuncture, or ear acupuncture as it is also known, uses similar skills to traditional acupuncture, but with acupuncture stimulation limited to the external ear. Traditional acupuncture has been practiced for over 2,500 years at least, and ear acupuncture is thought to have been around for the same length of time, although without the same notoriety. Auricular therapy has a long history of use in China. It was mentioned in the most famous of ancient Chinese medical textbooks, the Neijing. This ancient Chinese document was very specific about the needling of particular auricular points for the balancing of functional disorders related to a particular channel system. Auricular acupuncture owes a lot of its current popularity to the late Dr. Paul Noget, a French physician from Lyon. He is credited for research and development of auricular acupuncture since the 1950s and has even been nicknamed the father of modern auricular therapy by the Chinese. He famously drew a chart of ear points that was mapped from the shape of an inverted fetus. This microsystem meant that by stimulating points on the ear, the whole body could be treated. Following on from the concept, we can look at various auricular points that will have some bearing on our AcuLift treatment. Many acupuncturists who we know and have worked with are not that familiar with the points of the ear, unless of course they are auricular specialists. These points are some of the most powerful, and many practitioners achieve fantastic results with their patients by only using these points. In fact, there are many successful acupuncturists who run only auricular clinics. There are several fine publications specializing in auricular acupuncture, and they all seem to feature very accurate diagrams showing the many points on the ear. Personally, we will always use the point Shenmen, left, then right for every AcuLift treatment that we perform. It is an effective point to use in combination with classical points like Intang and 220 for relaxation and calming. Also, in conjunction with this, we will choose to use another auricular point that would correspond with a particular area of the face that we are keen to work on. For example, if we are interested in improving the area around the eyes, then we might consider auricular points that relate to this. Some of the points that we have found to be most successful alongside Shenmen are the points mandible, eyes, cheek, and mouth. However, we will be able to use the initial consultation to gauge which area to focus on for each particular patient. Our advice for any auricular points would be to research them and see what points work for you and then incorporate them into your own treatment protocol. When needling auricular points, we like to use a 15 mm by 0.20 mm 36 gauge needle. We find it advisable to use a sterile swab to clean the ear prior to this. This area can be very vulnerable and must be scrupulously cleaned before you begin. Like its counterpart on the body, Shenmen is a powerful point for calming the spirit. It can also be used as an analgesic in combination with the 3 constitutional anesthetic points. It should be needled first before selecting a follow-up point. Shenmen is a primary point to reduce excess heat or inflammation. As such, Shenmen is a major point used to stop skin itching or breakouts that are often attributed to heat in the heart or heat in the blood because the heart dominates the blood. The mouth point can be used to increase or decrease appetite. It is also referred to as the anti-fatigue point. It can also be used to treat mouth problems such as ulcers, canker sores, and deviation of the mouth. The forehead point is often used for headaches, but in this context can be employed for enhancing the forehead. This point is useful for treating local problems of the forehead such as wrinkles, acne, and pain and congestion of the sinuses and or forehead. It is used to treat Yangming, large intestine stomach headaches. Eye point. In the ear, this is the primary point to treat problems of the eye, such as decreased nighttime vision, eye strain, declining vision, myopia, presbyopia, eye twitching, and many other ophthalmological disorders. Temple. As you can guess, temple is used specifically for headaches in this location. However, it can also be used to focus on this area of the face. This is a local point for treating problems of the temple, such as breakouts, tension, temporal headaches, one-sided headaches, and migraines. It is sometimes called the Taiyang point because the body acupuncture point Taiyang is located at the temple. Cheek point is also known as face and is used for cases of facial paralysis and working with the facial muscles. It is recommended for treatment involving this part of the face, so it would be a useful point to include, particularly for lifting the cheek. Mandible point, also known as the jaw, this can be selected to target jowls. This point can be used for problems with the jaw, such as clicking, temporomandibular joint syndrome, and an aching or dislocated jaw. Neck point. Again, relating directly to its name, this point can be used to relieve tension in the neck. This is a fast working point for treating a host of neck problems, including stiff neck, torticollis, cervical disease, and misaligned vertebrae. Heart point has some correlation with Shenmen. This point can be used for all heart problems in both Oriental and Western diagnosis. Western diagnostic conditions would include tightness in the chest, palpitations, angina, circulation problems, hypertension, mitral valve prolapse, and stroke. Chinese diagnostic problems include all of these, as well as memory and concentration problems, emotional problems, anxiety, restlessness, and psychological disturbances, easy daytime sweat, and insomnia. Lung point. As the lung governs the skin, either lung 1 or lung 2 can be used to improve the complexion. Anyone presenting with skin rashes, rosacea, or acne could benefit from this auricular point. Sympathetic point is a pain-relieving point. The sympathetic branch corresponds to stress, flight, and fright reactions. Thus, the sympathetic point, when tonified, stimulates dilation of the blood vessels. Because of this ability, it is considered a primary point for pain, since certain types of pain, such as fixed, stabbing, boring pain in Oriental medicine, is considered caused by constriction or blood stagnation, which results in pain. Subcortex or brain point, thalamus point. This point is known for its anti-inflammatory effects and can reduce swelling. Therefore, it will help the face to calm down during the treatment. It is also a point used for acupuncture analgesia, so it would work well with the anesthetic points and boost the effects. 0 point or diaphragm point. This is thought to have a powerful influence in treating pain, sedation, addiction treatment, and inflammation. This point is also deemed to bring the whole body back into balance, and this homeostasis will be beneficial not only for how your patient looks, but for how they feel too. Relax muscle, an auricular point that literally does what its name suggests and relaxes the patient's muscles. This can be beneficial for patients who are struggling to unwind and really enjoy the treatment. Relaxed muscle is an important point for relieving pain. Endocrine point. This system in our bodies is responsible for the secretion of hormones into our bloodstream. So, where skin issues are caused by hormonal influences, this point can be used to help address this. Also, when the endocrine system is working efficiently, it will slow down the aging process and assist in retaining our vitality as we get older. Spleen. We discussed how the spleen sends fluid up to the lungs, and they then disperse moisture in the skin. So this point can assist with hydration. Choosing the spleen point on the ear can also help to tone the flesh. Kidney point. This organ relates to the aging process, as the kidney governs all stages of development. If your patient has bluish eye bags, you may like to try this point, as the kidney is often linked to this problem. The liver is linked to the eyes, and we can use this point to directly improve this area and decrease dark circles. Thank you for your attention.